welcome to my channel. My name is Cherechi. I'm a fertility nurse and also a staff nurse midwife. Please, if this is your first time of watching my video, kindly subscribe to my channel. So, in today's topic, I'll be discussing how you can increase your chances of twin pregnancy with Clomid and how this drug is being prescribed for you to achieve a positive result. First of all, you need to ask yourself this question: what is this drug called Clomid? It is an oral anti-estrogen medication, or it is a selective estrogen receptor modulator, meaning that it blocks estrogen receptor in the brain, to be precise, the hypothalamus. So how does this Clomid work? Once you are on this Clomid, it binds to the sites in the hypothalamus where estrogen receptor is meant to be. And when it is there, it blocks the level of estrogen. And once there is low level of estrogen, the hypothalamus will signal the pituitary gland to produce more of follicle stimulating hormone. And when there is high production of follicle stimulating hormone, there will be high recruitment of follicles, because those hormones, that is follicle stimulating hormones, are working directly on the ovaries. Then, how will I take this drug to achieve these positive results? Before the commencement of this procedure, the doctor must ensure that you have done the necessary blood tests to ensure that your hormonals are normal. So, on your day 2 or day 3 of your period, your health care provider will invite you to the hospital for an ultrasound scan. The reason for doing this is to rule out any cyst in the ovaries, because once there is cyst, a bigger cyst, this procedure will be cancelled. Then, on your day 3 or your day 5 of your period, you start this Clomid. Please, once it's more than 5 days of your period, do not start this medication again. This medication comes in 50 milligrams, and you're expected to take it for 5 days. That is 50 milligrams daily, one tablet daily for 5 days. Be it on day 3 or your day 5, you take it for 5 days in combination with folic acid, 5 milligrams daily. After these 5 days, few days later, your health care provider will invite you for ultrasound monitoring. The reason for this monitoring is to ensure that those follicles are not many, at least not more than 3. Once they are more than 3, the whole procedure will be cancelled to avoid the complications that comes with multiple pregnancy. Let's take for instance, once the follicles are 3, it's likely that 2 might contain eggs. So after fertilization, that could lead to twin pregnancy. But when the follicles are many, like 4 or 5, 3 or 4 might contain eggs. And after fertilization, it will lead to triplets or quadruplets, and their complications are higher compared to twin pregnancy. That is why once more than three follicles are suspected, that procedure will be accepted. Another reason for this monitoring is to know the actual time this trigger shot would be administered to you. It's an injection, although not in all cases. Some healthcare providers don't give these trigger shots, but when your healthcare provider wants to give you this trigger shot, it is with this ultrasound scan that will tell him or her the actual time that shot should be administered. So, as the procedure is gradually going, when it is right for him to trigger, the trigger shot will be given. And this works within 24 to 36 hours. Within this period, it is expected that you ovulate. And after this, you will be advised to go and have an intercourse with your husband continuous to achieve this result. But in a situation where there is no ultrasound scan monitoring, an average menstrual cycle is 28 days. So on day 14, you expected to ovulate. So from your day 12 to 17, you are fertile within that period. So you are free to go and meet with your husband. Then on the 19 or 21 days of your period, by that time, the trigger shot must have been given and you'll be meeting with your husband. Progesterone test will be conducted to check the level of your progesterone. And during this period, it is expected to be high. If it is high, that shows that you have ovulated. And if it is low, a vaginal suppository of this progesterone will be given to you as a supplement. 2 weeks later, from the day of your ovulation, you need to go and do your pregnancy test. If it comes out positive, 2 weeks later, that is 2 weeks after the confirmation of the pregnancy test, an ultrasound scan would be recommended for you to check for the number of gestational sacs you are likely to be. If this process is followed judiciously, the expected results will be actualized. Please don't forget to subscribe to my